watching Morning at NTV with Simon Kasiate, Mabel Kebirunji, and Brian Molondo.
17.59 billion Uganda shillings is needed for the 2016-2017 budget to be able to extend a helping hand to the elderly. That program that has been running in 15 districts where elderly people are given 25,000 shillings per month to, it's a stipend, if you like, to try and ameliorate them, make their lives a little bit better. So 17.5 billion is needed, but government says we only have 9 billion that is available, leaving a gap of about 8.59 billion shillings. And some people feel there's no commitment from government to take care of the elderly. But then there's the other school of thought. 25,000 shillings to each of these people. Is it actually something that is of necessity? Is it what they really need? Or should we be looking at other viable options? That's coming up in the big story. And joining me is Patrick Katabaazi, the policy analyst. Good morning, Patrick.
Good morning.
Government says they don't have enough money to roll this out. They wanted to push it to 35 districts. 15 is what has been happening, but they say they don't have enough money to cover all that. And you feel government is not demonstrating commitment?
I, first of all, must say that I don't believe that government does not have money. Government does have money, and there is evidence. This program has been piloted for quite many years. To be precise, the first phase, expanding social protection 1, was for 5 years. This is the second phase. Now, we have seen on a number of occasions government coming up with programs that attract high-level funding. One of the examples is the Youth Arrival Program, which started a few years ago, that has been well funded. The most recent being the Women Entrepreneurship Fund that started just last financial year, and this financial alone in the budget framework paper, it was allocated 50 billion. So in my view, we are talking about these sections of the population. We're talking about vulnerable persons in youth, vulnerable persons in women, vulnerable persons for the older persons. What is the difference? Because, I mean, if these other categories are to be catered for, why do you then say you can't find money for the older persons? That's a big question. So to answer your question directly, I don't believe that there is no money to fund some of these programs.
Patrick, this doling out of money that we are doing, give money to youth, give money to the women, with all due respect, I keep thinking, okay, are we actually ameliorating these young people? Or, these stipends you give them, they go spend it, and then before you know it, they're back. And now we give 25,000 shillings to the elderly, some of whom actually will spend nearly half of that money to go and access it, because it's not exactly at their doorstep. They've got to travel, go pick it, and that kind of thing. In the grand scheme of things, how does this ameliorate these people's lives? Maybe we should be looking at, I don't know, the bigger picture. That can try and get services closer to these people, because the 25,000 shillings they get, they'll tell you it's to help them when they have a medical challenge, and with age, that does come. If they have to do one or two things, maybe let's build the health centers close to them, make them work. Let's access this, make the services available to them, as opposed to this 25,000 shillings. I don't know.
You see, Joel, the bigger picture for enhancing social protection for the vulnerable is that you are trying to cushion the vulnerable of the vulnerable communities against shocks and risks in life. Take an example of a 90-year-old Ugandan. Do you think that person, even if you brought services closer to at his community, brought NADS, Operation Wealth Creation, even if you actually built a hospital within something like a 5-kilometer radius, do you think that person can enjoy those benefits, all those programs, if he's not capacitated? So we need also to come to terms with the fact that 30%, according to the Uganda National Household Survey and other researches that have been conducted, 30% of the older persons in Uganda live in extreme poverty. 71% of the households with older persons remain highly vulnerable. We need to appreciate.
Does 25,000 shillings make all these things better? Because if they're highly vulnerable, they are living in abject poverty, and we are saying 25,000 shillings. How does this, is this a handout or a hand up? I would like to think it's just a handout, which is not sustainable.
One of it would call it a handout, but it doesn't become a handout if you are working for a public service and you get a pension at the end of the month. So, but you are talking about
no, pension is different. That's my money. I'm entitled to it if I've been a public servant.
But there are Ugandans who have not had the benefit of working for government or working for a state corporation, but have worked for this country in the army, probably in World War I, World War II. There are those Ugandans who have paid taxes for so many years. By the way, we're talking about people who are 65 years and above. So ultimately, how does the state leave them to die in the communities, in very remote communities where they cannot access some of these basic services, where, as a matter of fact, they have been left on their own? And we need to take cognizance of the fact that the social structures have been breaking down. Previously, responsibility of looking after children and older persons was communal. But what are we seeing happening? We are seeing older persons being abandoned, young people leaving the villages, going to towns, having children, sending them back to these people. We have seen some families where parents have died, and the responsibility of looking after these children now goes to these older persons. So in my view, the issue of adequacy can be explained, but even at the level of 25,000, you automatically jump from extreme poverty to now that other Ugandan who can be able to purchase soap and wash, that Ugandan who can, by the way, get sugar if it is prescribed to you as medicine. You go into that category of a
sugar
Ugandan
prescribed as medicine?
Yes. I mean, there are some people who may not be able at that age to actually take sugar. So, in my own view, the 25,000, no matter how small it is, has been able to generate evidence to suggest that some of these small grants that are going to the communities have really, really transformed those communities. There has been a report that was authored by Minister of General Labour and Social Development and the Minister of Finance that do point to the very fact that this program in the 15 pilot districts of Uganda has done so well.
Look, there's 112 districts in this country. Well, they're going to increase to I don't know how many every so often. There's another that pops up. And this is happening in about 10% of these districts. And I'm thinking about the sustainability of this. How do you make sure that, okay, you decided to give this money to all the elderly people in this country, that all of them get, some are not left out? And then the sustainability, how are we going to keep doing this? Because you see, the cost of living keeps going higher, inflation, etc., etc. Then next year it will be, you know what, this 25,000 shillings doesn't make the cut. Let's push it to about 50,000 and so on. I'm looking at the sustainability of all this, and I don't get it. Please enlighten me.
Now, what is very important was that the project was piloted in 15 districts in Uganda. Now, last year on 1st of October 2015, government announced a gradual national rollout. As I speak, and according to the government plan, in the next 5 years, government is going to add on 40 districts. Like you said, that is still less than 50% in view of the fact that some more districts are being added now, so really it won't meet even 50%. But what members of parliament have been saying, including those that subscribe to the Parliamentary Reform on Social Protection within parliament, they are saying, look here, you can have a model that goes district by district, but then you can also have a model that does targeting, direct targeting, where you can identify 100 oldest person in every sub-county, in every corner of this Uganda, so that they can benefit, all Ugandans can benefit from this program. Because as it is right now, you have older persons in the 15 districts of this country who have benefited for the last 6 years. Now, you add another 40, the 15 remain. So those become 10 years before you start into another district. So there is need for a national debate about this with a view of pushing government to ensure that we have a complete national rollout. But then the other question that you said, how sustainable is it? This is a social protection measure, as the name suggests. But as the nation grows, one of the things that we would love to see is a comprehensive social or pension reform that targets both formal and informal sector. As it is right now, people in the formal sector are not targeted by any pension arrangement. So, as we move forward, one of the things that can be done, if we have a social, rather a pension strategy that targets people at an early age, such as probably like me and you, then you reduce risk of future vulnerabilities that might come with incapacity to work. And for me, that's where the solution lies. But before we get there, then some of these people who are extremely vulnerable in our communities should not be left out of development, because our model of development is reliant on the forces of demand and supply. And there are some Ugandans who may never at all benefit from these forces of demand and supply because of the nature of the circumstances, like old age.
Is there cogent evidence that actually these people's lives are getting better? What do they use this money for example? If we have done any research on this.
I have had the benefit to go to the field in the pilot districts, and I've been able to see or hear testimonies from older persons where they have used this money to participate in other government programs. Like, for instance, I met a woman who is looking after children from the daughter, and uses this money to buy books and some little scholastic material to support the grandson to participate effectively in UP program. We have seen testimonies of older persons saying that now happily they can join community meetings. So imagine a world where you don't have clothes, or if you had them, you have not washed them for the last so many months. Now you can buy soap. So yeah, it has boosted your self-esteem. You can even go to the wedding and contribute 1,000. By the way, you can even go to the bar and spend 500 shillings and be happy and become another member of society. And that is how actually people live longer.
So when people go to bars, they get happy.
That's how people live longer. The sense of feeling that, hey, I am also a human being. I cannot be left when other people are moving. One of other things, again, there's a very interesting story in Katabaazi where somebody saved this money and was able to redesign and perhaps make her shelter much better than it was. Some people are investing, some people are participating in agriculture where they cannot possibly participate because of the nature of their health, like getting that money to hire a laborer for a day to plant a garden, vegetable garden around the house, which ordinarily would be very, very difficult because some of these older persons that we are talking about are extremely weak by the nature of their age and probably some of the diseases that come along with age.
Forgive my school of thought, Patrick, but I fundamentally have a problem with money being doled out to people, to citizens, be they youth, be they women, be they elderly people, with all due respect. And some of them are very vulnerable. And look, this can be a shot in the arm as a temporary stopgap measure that can be done, and I think they need help. But I'm looking at the long haul of what can we do to avoid this? Because you see, we have made these our citizens, become beggars towards the state. In many ways, it enfeebles them. It is very disempowering. And I'm thinking we probably need to think ways of how we don't have to keep doling out money to our citizens to spend. Something should be better done.
So, like the spirit of the youth level program is actually not to dole money out. It is for creating a fund where youth can be able to get money from, invest, and return it. Of course, the implementation and the stories that are arising out of it, that would be a different matter, or a matter for debate another day. I think the same with the spirit of the Women Entrepreneurship Fund. But for this one, it is a social protection. You're protecting a certain section of the community against vulnerabilities, and it has to be treated differently. But you said, what would be the end game? Now, if you have a pension program that targets the informal sector, remember, we have said on quite a number of occasions that people who are in agriculture are also employed. To be employed does not necessarily mean that you have an office, that you come to work at NTV, and that's the only employment that people know. Now, here we are saying, even in informal sector, that is employment. But now, can we have a pension strategy where people who are working on their own, working for themselves, working plantations, can also have a saving that can be able to support these people when they can no longer work, especially so when they have clocked the age of retirement. That is where the solution lies, like I said. But we cannot again say that we wait for that time when Uganda probably rolls out some of those comprehensive social protection measures that are outward looking for the excluded sections of the society to also be brought on board.
Well,
so in my view, some of these interventions are not really lifetime interventions. And as you can see, as the economy grows and as the government rolls out plans to capture the informal sector, you will see the government's liability towards providing these funds to these persons actually reducing, as it is in most of these countries.
Hopefully it reduces and doesn't get a lot higher, because if people realize, all right, government can actually give us money, then they go out and beg for it. But at least what's important is that we need to make the lives of these old folks a lot better. That's very important.
That's very important, and that is why members of parliament, because some members of parliament have lost their seats, because this program is happening in other districts and other constituencies, and some section of the population thinks that the members of parliament are not doing so much to advocate for some of these programs to come to their constituencies. So this is to put new members of parliament on notice that, hey, look here, the life of this program, as it has been before, will still be dependent on how parliament handles this money, because
that sounds like manipulation.
Yes,
but,
because
you know, if you're not able to get us money, whether it be from your pocket or from government, so we don't vote for you.
For the last 3 financial years or so, we have seen lack of demonstrable will from the side of government in terms of providing adequate resources for counterpart funding, because in any case, this project is largely funded by development partners. And what the government of Uganda has committed, like in this financial year, the total budget for as part of government counterpart funding has been, is 17.59 billion. What do we have in the budget? 9 billion. What will Parliament have to do, using the appropriation powers, to look for an extra 8.59 billion so that this program can move as scheduled?
Well, that they can find it. They just have to pay taxes. We have 41 billion shillings. They have to cut down on these supplementaries to State House and the like. Anyhow, let's see how things get better. Patrick Katabaazi, thanks for talking to us this morning.
The pleasure is mine. Thanks for hosting me.
Coming up is my opinion. Look, a society that does not care for the most vulnerable people among them, the women, the children, the elderly, that society should be ashamed of itself. What we can pettifog over is how to make sure these interventions are in place. You know, do we give these vulnerable people a handout or a hand up? Because you see, a hand up is a lot more sustainable. You give them a hand up, then they can be able to walk. Handout, they remain down there and you have to keep giving them a handout. So let's see how the discussion keeps going on. But then again, these young people that have run away from their parents, their elderly parents, they're not catering for them. I think it's important we need to rethink about some of these things. We probably don't need a law. Like I think it is China, where they've set a law. If your parents are above, 80 years of age and you don't visit them once a month, there's a fine and even, imprisonment if that gets to be the case. I don't think we need to get to that point. It's important that we look after these good people and make things better. And that's it for the big story. Thanks a bunch for joining us. My name is Joel Senyonyi. Coming up in a bit is Everyday Life.
You're watching Morning at NTV.